Imagine this: your body is sending you quiet warning signals every day, but you're too busy to notice. Colon cancer doesn't usually shout, it whispers, and by the time it screams, it can be too late. That's why knowing the warning signs of colon cancer can truly save a life, possibly your own. 1. Persistent changes in bowel habits. Persistent changes in bowel habits are one of the most overlooked yet important warning signs of colon cancer. And many people ignore them because they seem harmless or temporary. A change in bowel habits means your normal pattern suddenly becomes different and stays that way for weeks. This can include ongoing constipation, frequent diarrhea, alternating between the two, or noticing that your stools have become unusually thin, narrow, or ribbon-like. These changes are not just digestive inconveniences, they can signal that something inside the colon is interfering with normal bowel movement. When a tumor begins to grow in the colon, it can partially block the passage of stool. This blockage may slow digestion, causing constipation, or irritate the bowel lining, leading to diarrhea. Over time, the stool may change shape as it passes around the blockage, which is why pencil-thin stools should never be ignored. Many people assume these changes are caused by stress, aging, diet, or temporary stomach issues, but colon cancer often develops slowly and quietly, making these subtle changes easy to dismiss. Another warning sign is the constant urge to use the bathroom even after just going or feeling like the bowel never fully empties. This sensation can persist for weeks and may gradually worsen. What makes this especially dangerous is that these symptoms can appear without pain, allowing the disease to progress unnoticed. Doctors emphasize that bowel habit changes lasting longer than 2 to 3 weeks should always be checked, especially for adults over 45 or those with a family history of colon cancer. Early detection dramatically increases survival rates. Listening to your body and taking persistent bowel changes seriously could mean the difference between early treatment and late discovery. Ignoring these signs doesn't make them go away, it only gives the disease time to grow. 2. Blood in the stool. Blood in the stool is one of the most serious warning signs of colon cancer. Yet it is also one of the most commonly ignored. Many people dismiss it as hemorrhoids, minor tears, or temporary digestive issues, especially if there is no pain. However, bleeding from the colon is never normal and should always be taken seriously. Colon cancer can cause bleeding when a tumor damages the lining of the intestine or erodes nearby blood vessels, allowing blood to mix with stool. The appearance of the blood can vary depending on where the problem is located. Bright red blood often suggests bleeding in the lower part of the colon or rectum, while dark red or black, tar-like stools may indicate bleeding higher up in the digestive tract. In some cases, the blood may not be visible at all but slowly lost over time, leading to anemia, weakness, dizziness, and constant fatigue. This hidden blood loss makes colon cancer especially dangerous because the disease can progress silently without obvious symptoms. Another reason blood in the stool is ignored is because it may come and go. Bleeding might appear once, disappear for weeks, and then return. This on and off pattern can create a false sense of security, causing people to delay medical care. Unfortunately, early-stage colon cancer often behaves this way, bleeding intermittently as the tumor grows. Medical experts strongly warn that any blood in the stool, no matter the color, amount, or frequency, requires evaluation. Waiting for pain or worsening symptoms can allow the cancer to spread beyond the colon, making treatment more difficult. Colon cancer is highly treatable when detected early, but delayed diagnosis significantly reduces survival chances. Paying attention to your stool may feel uncomfortable or awkward, but it is a powerful tool for protecting your health. If you notice blood even once, Don't ignore it or self-diagnose. Acting early could save your life. Point 3. Ongoing abdominal pain or cramping. Ongoing abdominal pain or cramping is another warning sign of colon cancer that people often ignore or explain away as indigestion, gas, or normal stomach trouble. Occasional stomach discomfort is common, but pain that keeps coming back, lasts for weeks, or gradually worsens should never be dismissed. Colon cancer-related pain is often dull, persistent, and located in the lower abdomen, but it can also feel like constant pressure, bloating, or unexplained discomfort after eating. As a tumor grows inside the colon, it can partially block the intestine, making it harder for food and waste to pass through. This blockage causes cramping, as the bowel works harder to move stool along over time. This can lead to painful spasms, swelling, and a feeling of fullness that doesn't go away. Some people notice the pain increases after meals, while others feel discomfort throughout the day, regardless of what they eat. What makes this symptom especially dangerous is that it may not be severe at first. The pain can be mild and easy to ignore, leading people to rely on antacids, pain relievers, or home remedies. Unfortunately, masking the pain does not address the underlying cause in some cases. Abdominal pain may come with nausea, changes in appetite, or frequent bloating, all of which are signs the digestive system is under stress. Another concerning factor is pain combined with changes in bowel habits or unexplained weight loss. This combination strongly suggests something more serious than a simple digestive issue. Colon cancer can grow slowly, and abdominal discomfort may be one of the earliest signals before more obvious symptoms appear. Doctors advise that any abdominal pain lasting longer than 2 to 3 weeks, especially in adults over 45, should be evaluated. Listening to persistent pain and seeking medical advice early can lead to timely diagnosis, simpler treatment, and significantly better outcomes. Ignoring it only gives the disease more time to progress. 4. Unexplained weight loss and fatigue. Unexplained weight loss and constant fatigue are silent but powerful warning signs of colon cancer that many people mistakenly attribute to aging, stress, or a busy lifestyle. Losing weight without changing your diet or activity level is not normal, especially when it happens steadily over a short period. Colon cancer can alter the way your body processes nutrients, preventing proper absorption and causing the body to burn energy at an abnormal rate. As a result, weight may drop even though eating habits remain the same. Fatigue often appears alongside weight loss and is more than just feeling tired. It is a deep, persistent exhaustion that does not improve with rest or sleep. One major reason for this is internal bleeding caused by tumors in the colon. Slow, unnoticed blood loss can lead to iron deficiency anemia, reducing oxygen delivery throughout the body and leaving you feeling weak, dizzy, and drained. Many people live with this fatigue for months, assuming it is normal or unavoidable, while the underlying cause continues to worsen. What makes these symptoms especially dangerous is their subtlety. There may be no pain, no digestive discomfort, and no obvious signs pointing directly to the colon. This allows the cancer to grow quietly while the body struggles in the background. People may also notice reduced appetite, difficulty concentrating, or shortness of breath during simple activities, all signs that the body is under serious strain. Doctors stress that unexplained weight loss combined with ongoing fatigue should never be ignored. Particularly in adults over 45, these symptoms are often signs that the body is fighting a serious condition. Early evaluation can lead to early detection, when treatment is most effective. Ignoring these changes does not make them disappear, it only delays diagnosis and reduces the chances of successful recovery. 5. Feeling of incomplete bowel emptying. The constant feeling that the bowel does not fully empty after using the bathroom is a subtle but serious warning sign of colon cancer that many people overlook or feel embarrassed to talk about. This sensation can make it seem like you need to go again shortly after finishing, even when little or nothing happens. While this may occasionally occur due to diet or temporary digestive issues, experiencing it frequently or for several weeks should never be ignored. This symptom often occurs when a growth or tumor in the colon or rectum partially blocks the passage of stool. As waste moves through the intestine, the blockage creates pressure and irritation, sending false signals to the brain that the bowel is still full. Over time, this can lead to repeated trips to the bathroom, straining, and discomfort, even though the bowel has already emptied as much as it can. What makes this warning sign especially dangerous is that it may appear without pain or visible blood. Because there is no immediate discomfort, many people assume it is harmless and delay seeking medical advice. In reality, this sensation can be an early indicator of a physical obstruction inside the colon, allowing cancer to progress quietly. This symptom is often accompanied by other changes, such as thinner stools, constipation, or alternating bowel habits. When these signs occur together, they strongly suggest that the normal function of the colon is being disrupted. Unfortunately, many people normalize these changes, especially as they get older, believing them to be a natural part of aging. Medical experts emphasize that any persistent feeling of incomplete bowel emptying, particularly in adults over 45, should be evaluated promptly. Early detection of colon cancer greatly improves survival and treatment outcomes. Paying attention to this uncomfortable but important signal could make the difference between catching the disease early and discovering it too late.